Hello. If you're here today, chances are you scanned a QR code after seeing our mobile vasectomy clinic, which is actually real, and we do vasectomies there. You're probably curious to know what this is about. Perhaps seeing a vehicle with numerous printed sperm, the word vasectomy, and suggestive phrases appear unexpected to you. Sure, that is something most of us would not expect. However, I can assure you that this is not an attempt to make men just uncomfortable or to play simply a joke. This is a serious proposition and a legitimate manifestation of concern for a more equitable participation of men in reproductive decisions. In the world, women carry most of the responsibility in reproduction. Biology has entrusted them with the great power of nurturing a human being until capable of living on their own, at least not attached physically to another human. That is something we as men, despite our fundamental participation in procreation, have been spared from. Advances in medicine provided women, starting in the 1960s, with tools that allowed them a better control of such power and to determine when to use it. Birth control pills, IUDs, implants, injections, and multiple variations of those have been developed and promoted for the intermittent and temporary control of their fertility. At the same time, we have been left with very few options, actually only one reasonable temporary option, condoms, to participate in birth control, and many don't even like to use it. There is clearly an imbalance when it comes to reproductive responsibilities. We help procreate and are an important and fundamental part of the process, but let's be honest, we carry the most joyful part of this. Women, on the other hand, are the ones with the body changes, the back pain, the frequent urination, the hemorrhoids, the big belly, the pushing of a human being out of their bodies, the contraceptive side effects, and so forth. They are just plainly carrying a bigger burden in the reproductive process. Having children is a decision that pertains to the individual and their partner. Defining when one is satisfied with his or her own fertility is absolutely a personal matter, but given that our participation is limited beyond procreation and that our temporary options are scant, it makes sense that when that fertility satisfaction has been reached, a permanent decision is made for not having more children or any at all, we step up to the plate and play a more active role. The options for a permanent control of our fertility are very specific and vary depending on the location of our reproductive organs. For women, the need for a more invasive intervention stems from the simple fact that their organs are internal, inside their abdomen and pelvis. For that, they would have to undergo a more complex process through a surgery that demands more intervention and therefore more risk. In our case, we have been given the biological feature and perhaps advantage of having our reproductive organs more exposed. This means that modifying them for a permanent control of our fertility is just simpler and easier with less intervention and less risk. A vasectomy, for those men and families whose fertility has been satisfied, is a great opportunity to share better the reproductive responsibilities that women have mostly carried. A vasectomy shows that men are willing to participate more in reproduction beyond just making babies. Equity and equality in reproduction is achieved not by giving equal number of chromosomes for the formation of a human being. Equity and equality is achieved by sharing the associated responsibilities in reproduction through a more balanced participation in contraception too. Getting snipped, when the time is right for such decision, will definitely be a step in the direction of a more balanced participation. It is certainly a snip in the right direction.